Hello, this is Dr. Kaustav Basu. I am a senior consultant in Gynecologic Oncology and Robotic Surgery at Narayana Hospital, Howrah. Today we are going to talk about Human Papillomavirus infection. So, this virus is being contracted from the men to the women by sexual intercourse, and this virus generally it's a commensal, vaginal commensal virus which normally stays within a female body, especially in the genital tract. But because of some chronic conditions like malnutrition, like chronic infections, tuberculosis, like some autoimmune diseases for which a patient has to take continuous steroids, patients who are like renal transplant patients, liver transplant patients who have to take lifelong steroids and immunotherapy, though they are at risk of developing low immunity. And in cases of this low immunity, the virus tends to penetrate within the human body and cause some cellular changes. We call these as oncogenic changes, and which develop some conditions like precancer and cancer. So, this cancer is thus caused by this human papillomavirus, the most common cancer being cervical cancer in women. So, there are questions raised that do men acquire this virus? Yes, definitely I would say this. The main population, the male population are the sources of this virus from which the virus is being transmitted to the women. And in fact, in Western world where homosexuality is a practice, it can be transmitted to the male to male as well. So, in fact, I would say the good hygiene within the male partner is also very required to for the this virus to be contracted by the female. If the partner's hygiene is well maintained, the female's chances of infection and prolonged infection is much less in the female partner. So, there also you may raise a question, the doctor, I have this HPV virus infection, is my fertility is going to be affected? So, that's a very common question because we regularly face this sort of questions in our clinic. So, directly there is no evidence that human papillomavirus affects the pregnancy outcome or affects the lady to conceive. But overall, if you see the associated problems, malnutrition, chronic infection, and autoimmune diseases, all these may also cause difficulty to the lady to conceive. So, it's not only the cervical, the viral infection which is cause of the infertility. So, directly if I say, it has no role in infertility. On the other hand, in fact, even if the patient gets pregnant and they gets detected, because for the first time the lady is being inspected by the gynecologist during her pregnancy. So, it is a very common practice that we detect early cervical cancer during pregnancy. Okay, so there is nothing to worry, because we do a lot of patients who come to us during their pregnancy with cervical cancer or pre-cancer. We try to do conservative management for those cases. We try to defer the treatment of cancer till the pregnancy is complete, and then we do definitive treatment of the cancer. So, even if you get cancer during pregnancy, nothing to worry, because it is a very slow growing cancer because of latent viral infection. And the most important thing, and there is a very positive message I would like to give all of you, that there is a vaccine against this viral infection, human papillomavirus. This vaccine is being now made indigenously in India and will be available very soon through our government immunization centers. And it is targeted to the young children 9 to 14 years. Even if you are not within that group of 9 to 14, you can take the vaccines, but it won't be that much effective if you take within 9 to 14. It's usually a 2 to 3 dose vaccine virus. No booster dose is required. And if you can take the vaccine, a complete course of vaccine, I am sure that viral infection and obviously the cancer will be eliminated from country like India. Thank you so much.